Hi there, and welcome to Freeman Medical Clinic. I am a doctor of osteopathy, and I'm going to give you a demonstration of what osteopathy is. When you come and see your osteopath, you may have ankle pain, and we may start up here at your neck. You may have headache or neck pain, and we may start all the way down at your feet. Each osteopath has their own particular approach. Mine is to almost always start at the feet and work my way up. And the reason for these things is that everything is connected via the fascia, via the ligaments, the tendons, everything in the body is connected. So something may be happening to you and you may experience pain, for example, in one area of your body. But with osteopathy, we like to just go ahead and fix any problem that may not yet be causing you pain or may be connected to the issue at hand that's causing pain. So in our example today, which is our lovely nurse practitioner, Celeste. Celeste, are you having any body aches or pains anywhere today?
Just my back right here, it always hurts.
Okay, so her mid-back always hurts and that's flaring on her today. I'm going to just ease her arms into a more natural position so that she can relax on the table. And this is her first time experiencing osteopathic manipulation, which is super fun and pertinent for the educational purposes of today. So I start down here and I'm always looking at the pupils to see what I can see. So from this vantage point, I see right up there on that thoracic rib cage of hers that her right side is a little higher than her left side. She has a slight scoliosis that has its convexity to the right, so concomitant concavity would be to the left for some compensation. I can see by the way the folds of her pants sit that her sacrum is posterior on the left. Her right thigh is more developed than her left. A little bit of changes in the lower extremity, I'm not exactly sure what yet. And her right leg is longer than her left leg, but is it? Because if the hips are out of alignment, the legs come out of the hips, right? So if the hip is out of alignment, it might look like a longer leg, might not be. So we'll see. To be determined. She has a deeper hole on the heel of her right sock than her left, and that is the side that is longer, which tells me that she probably has more pressure on that side, which goes along with that longer apparent or physiologic longer leg. So that tells me this has been going on for some time. So she'll be out of alignment, as most people are. One good question that I get asked frequently from my patients and from people I meet anywhere when they find out I'm an osteopath is, how frequently should you come in for an adjustment? I recommend that anytime you're having any issues, schedule an appointment, come on in. Otherwise, if you aren't having any problems, come in with the seasons. So 4 times a year, any season, let your osteopath adjust you before you're having any issues. That's a good rule of thumb. All right. So let's get our hands on the body because that's the most fun part. And when you're working on someone, I know that I have several osteopaths who follow me. This is a long-term game. You want to look at your osteopathic career, I recommend, as a marathon, not a sprint. So always have your body mechanics in mind. So before I touch the patient, I go ahead and engage my core. I'm thinking about not being extended out of my joints, but having a strong stability. I take an athletic stance with my feet. Okay. Then I get right on in. And I like to say to my patients, hey, everything I do should feel good. Sometimes it's gonna feel like a stretch. If anything I do doesn't feel good, say stop, and I will. You are always in control. This is particularly important for folks who have had negative experiences with our healthcare system, and sadly, that is not infrequent. So we all like to feel like we're in control, so just remind your patients that they're in control, okay? And if you're my patient, I forget to remind you of that. feel free to remind me. And I'm not trying to pop her toes, quote unquote here, just releasing any tension in her fascia. She has nice high arches, just noticing that. Palpating. A lot of times here I can pick up on prior trauma. That was my wrist. In the ankle, and everything feels nice and symmetrical in there. Nothing calling out to me for help. Now we get into the fascia of the calves. Super tight. Not consistent with trauma per se, but with folks who do a lot of standing, our legs just get tight. That's what they do. And then I mentioned her sacrum before, so I'm gonna ease on up into here. And the ischial tuberosity fits really nicely into the palm of my hand, just like that. Just go right on up there and release the fascia here. So I mentioned earlier that everything is connected through the fascia. And if you've ever skinned a deer, cut a chicken, or you've ever seen the inside of any body of an animal, you see that silvery substance, that's the fascia, and that connects everything. There are some areas where the fascia particularly gets bunched up, medical term, gets bunched up, and behind the knees is one such place. So it feels really good, almost no matter what's happening, to release the fascia behind the knees. It's good for the body, and therefore good for the brain. The brain picks up on that. There are a lot of nerve endings, not nerve endings, well, some nerve endings, but nerves that flow through that area, and that's why it feels so good. The fascia itself is not innervated, but when you release the fascia of an area with a lot of nerve activity, that signal goes back to the brain, and the brain's like, oh, I like that. I'm gonna go ahead and come over here to the other side. There are two types of licensed medical doctors in the United States. MDs, which stands for medical doctor, and DOs, DO standing for doctor of osteopathy. We are both equally licensed and allowed to practice medicine. So she's a little hyperextended on this side. Any specialty is represented by both MDs and DOs, and by specialty I mean neurosurgery, rheumatology, family medicine, all the specialties have both. And the training is mostly the same. Osteopaths do get this extra training in body hands-on manipulation. Not all osteopaths like doing that, and not all osteopaths incorporate this work. So if you're looking for an osteopath who does hands-on manipulation, I recommend starting at the American Academy of Osteopathy or the American Association of Osteopathy, and finding an osteopath in your area. There's a really nice lookup by zip code directory, and then call also and just double check, ask, does this osteopath do manipulation? And if they say, oh, we don't know what that is, the answer is no, most likely. If they say, oh yes, our doctor loves to get their hands on the body, then you know you've hit some pay dirt. So yeah, her sacrum is rotated here. So I'm going to start with gentle techniques. These are what you're watching me do here today so far. Direct and indirect fascial techniques. Super gentle, easy, they work with the body. We also do, and I also do high velocity, I'm looking over my glasses like a librarian. I also do high velocity, low amplitude thrusting. That's the kind of movement you may be used to, someone popping your back or popping your neck. The older I get, the longer I have the privilege of this career, the more I find that that I think has a lot to do with I'm just a lot better. I have more years under my belt, more adept at palpating tissues, and so things just don't take as much force to release. All right, now we get up here, we're getting to the excitement area, right? This is the area where she experiences her pain. So this rolling is therapeutic, it's also diagnostic. So I'm listening through my hands. Hey, I'm picking up on how she's rotating, then I can get my hand up in here on the paraspinals and also listen, hey, what's happening in here with her muscles? And like I say, it's therapeutic at the same time because it feels good and it's loosening up all the physical elements in her body. Osteo is the Latin word for bone, so the name osteopathy or osteopathic does get its roots and its origin in bone, but it's not just the bone. As you can see, it's all the things.
That feels so good.
Doesn't it?
Oh my gosh.
Good, I'm glad. It should. That's the idea. So a lot of people weren't coming in to our office, and I think doctors' offices in particular, for a couple of years because of COVID. And if you have been putting off your osteopathic treatment wherever you may be, go ahead and schedule because we're ready. We're ready to be back with people, ready to put our hands on people. Patients are ready to be evaluated and treated physically, so don't delay. In the United States, osteopaths, as I mentioned, are fully licensed medical doctors. That is not true in every country. In some other places, for example, France, osteopaths can practice this body work, osteopathy, much like a physical therapist, but they don't go to a full-on medical school like we do here. So if you go to another country and you see an osteopath, do it, but know that they won't also be able to manage your diabetes, your blood pressure, or prescribe medication. Oh, right there. So a nice release right there. Now Celeste does have 2 ribs out of alignment, so I'm going to ask her to roll over onto her back. You gonna do a high velocity?
Absolutely.
Okay. She's a model patient, this Celeste. In. Let it all the way out. Oh, okay. So gotta go ahead and lay back. Got a lot of crunchies there, and that usually does elicit a similar response of ecstasy.
Yes,
it feels
good.
great.
It was good.
And there's no telling how long that's been a coming. So you can see that her right foot turns in more than the left foot. Her pelvis is out of alignment, and that's probably where all that's coming from. So I'm just gonna get right on up here and check her hip heights. Go ahead and lay on this side. Your osteopath may get her hands up into short, strong muscles, all up into the pelvis, from the back side or the underside up into the rectal area. And that's because you have muscles there. And in this day and age where we're very sensitive, we want to be respectful of people. So I usually just will say, this may seem very personal, where I suggest releasing some of your muscles. Give people the option to say, I really am not comfortable with that. I don't want your hands going up in there. Sometimes for women with the breast tissue, like these are pectorals, these are muscles up in here. But do ask, because not everyone is comfortable with that. And remember, we don't always know, well, we don't usually know people's history and maybe people's traumas or their triggers. So it's good to ask. I find that the vast majority of people are very open to me releasing anything that is in the body that is out of alignment. Okay, so we're gonna have you straighten your bottom leg out. Perfect. And then I'm going to bend her knee here until I feel movement at that lumbosacral junction, which is right there. And then I'm gonna twist her upper body a little bit more. Perfect. Now hold your elbows like I Dream of Jeannie. And the kids don't know what I Dream of Jeannie is. But if you don't remember, she went like this. And she would make things happen. You probably remember I Dream of Jeannie. Yeah, she was amazing. All right, so take a big deep breath. Let it all the way out. And then flat on your back. All right, look at that. Much better movement and closer to equal in the pelvis. And look at that, her feet are getting closer to approximately each other's length. I don't think it's the end of the story for her pelvis though. Okay, that looks pretty good. She's rotated, she's still a little bit anterior on the right. And I'm gonna fine tune her. So I like to do a little leg tug for the anterior innominate. I really wasn't picking up that it was inferior, but it might be a little. Now go ahead and bend your knees and let your feet be on the table. Separate your feet by a few inches and then a little bit pigeon-toed. Perfect, just like that. And pull your knees apart. 1, 2, 3, relax. Do that again. 1, 2, 3, relax. Perfect. Now pull your knees together. So what I just did was I gapped her pubic symphysis. Where the pubic bones, where the two sides come together, there is cartilage in there. And when the symphysis is out of alignment, you can gap it. Doesn't move this much, but to be dramatic. And sometimes that can feel unsettling, especially for males, but it's awesome. It really opens that pelvis up. So let's see how we're looking now. Just getting a little more movement each time. These are getting closer each time. All right. And for folks who may not have any physical issues, or if they only want me to focus on their brain or their emotions, that too can be helped with hands-on work. So I'm going to demonstrate, and you can just let your arms do whatever they want, by the way. This is cranial work. It's also referred to as craniosacral. Why is that, you ask? Good question. So the cranium is up here. The cranium are the bones that hold the skull. Sorry, the skull is the bones. That's the cranium that hold the brain. The brain is the headquarters, or the headwaters, if you will, of the nervous system. And on the back side of the skull is a hole, H-O-L-E, the magnum foramen, foramen magnum, also Latin. Foramen means opening or aperture. Magnum means big. So the spinal cord comes right out of that brain. The brainstem is part of that, and the spinal cord travels all the way down to the sacrum, which is the bone at the base of the spinal cord. And that's where everything happens. That's your computer, okay? That's your switchboard. All the nerves that allow us to move our arms and legs, nerves that collect all the pleasure from those areas of the body and bring those sensations back to our brain. And just about everything in between happens from the nerves. So there are nerves that go out of the nervous system that innervate our organs, our muscles, our bones, all the things, and those are called afferent nerves. And if you're a medical student, I like to remember afferent starts with an A and away starts with an A. So the afferent carries the nervous impulses away. And then the efferent, which starts with an E, I can't tell you how to remember that, it's just the other one. The efferent nerves bring all the information from bones and from areas in the body back to the nervous system. So it's really a circle, and that is something that osteopaths tend to focus on more than the traditional MD training, is this circle of afferent and efferent nerves. And that's where a lot of the current scientific breakthroughs are happening, is with the study of the afferent and efferent nerves, which is super exciting. There are paired bones in the cranium. I'll use an example of the temporal bones here. And if you look at a skull, a dried skull of a human or any other animal that is a vertebrate, the bones come together like the gills of a fish. They're not just, it's not just straight and locked. There are these interlocking tiny joints, and that's to allow the subtle movement. I'm being dramatic, it's much more subtle than this, of the paired bones to allow for the flow of the cerebrospinal fluid. So this whole beautiful brain nervous system situation is bathed in cerebrospinal fluid. Cerebral meaning the brain, spinal meaning the spinal cord, right? So you have this flow of cerebrospinal fluid bathes the brain, goes down the spinal cord, bathes the sacrum, comes back up, and it's this flow. And it is its own, has its own timing. It is not exactly connected to the respiratory timing, which is the breath. It's not exactly tied to the heartbeat, which is the pulse. It's its own, but we can get it to line up with the breath, with good deep breathing. We can get it to line up with the heartbeat, and I could go really in depth on that. I won't, but I might on another YouTube video if you ask me to. This is what we in Western medicine call cerebrospinal fluid, as I just mentioned. This is what a lot of Chinese medicine practitioners and other Oriental medicine folks refer to as the qi, or the life force, and indeed it is, because we need it for life to happen. And so I'm palpating subtle movements in our paired bones here, and this is typically a craniosacral session, typically lasts about 45 minutes. If you come in for a full body treatment, that is about 45 minutes. I can tailor it. I always tailor it to the individual's needs, and what is best for you one day might not be what's best for you another day. You're also always welcome to come in here and let me know that you don't really have any preconceived notions or desires, and just let me do my thing. Don't worry, I'll find something to work on or play with on your body, because there's always something. I am trained in the intraoral release techniques for the TMJ, which stands for temporomandibular joint, or a super tight jaw. A lot of times folks with bruxism or rubbing together of their teeth, that it can be stress related, but you know what, it's actually been well studied. Probably not so much stress related, probably just a habit that people get into. So if you have that and you've been recommended for surgery, or they break your jaw and rewire it, my suggestion is you can always undergo that surgery, and sometimes it's necessary and super helpful, but allow an osteopath who's well trained to get in there and do our magic. We can also release the muscles with Botox, and Celeste in particular is our resident Botox and fillers expert. But let me do this gentler technique that works with the body first, because sometimes it's just super helpful. And I'm gonna skip over some things, but I wanna make sure I hit the highlights for y'all. I like to address T1, which is that most superior of the thoracic vertebrae through the thoracic inlet. Whenever I do this, I'm reminded of a patient years ago who had thoracic outlet syndrome. It was so cool because I was able to, I felt it, I palpated it. So, and she was young, she was in her 20s. Got her straight to the surgeon. Back then, that was Dallas. Now we probably have a surgeon in Austin who could handle that, but that was really interesting. So Celeste is quite superior on the left. So my fingers don't go as deeply on the left as they do on the right. So she's side bent left, which means she's rotated right, and I can almost feel that rotation coming down in there. So I like to warm up the neck with figures of 8. This is also a crowd favorite. And then with my right hand supporting her head, I'm going to do a little springing technique here. And this evens out the blood flow to your head. So if you have a big exam coming up or a presentation or something where you want your brain to be at its best, that's also another fun time to come into your osteopath and get an adjustment. You know what? I think you have a thoracic rib. Did you know that?
No.
Yeah, I think you have like a little extra rib down in here.
That's weird.
It's just you. It's just your way of being perfect. Okay, so now we have closer to equal movements. I'm going to just let her head relax like this. This is, I also will incorporate passive techniques. Sometimes these are referred to as the Jones strain counter strain. I'm not doing traditional strain counter strain, but just letting, her body is asking to be in this position, so I'm letting that happen. And I also do some really fun techniques for the organs. So sometimes people will have a sphincter issue. So their gastric sphincter may be locked up, and anyone with GERD or reflux, I'm not gonna do this because she doesn't have those issues, and it can be a little tender in there, but I may release that gastric sphincter directly there. Similarly with techniques that can help the other internal organs. And I mentioned the pelvis, and so especially women who have incontinence or men who have any penile disorder, I will get my thumbs up in your business, up in those muscles, and release them, because a lot of times it's just more helpful. Yes, it does take more time, and it is more delicate to go ahead and fix the underlying problem. But the beauty of being an osteopath is I can start there, and then if you still need a medication, I can prescribe that. But boy, does it feel good to not just get out the script pad and do a prescription for someone, but get at what might be the real underlying issues for them. So I think that's a good first YouTube video for osteopathic manipulation.
That was amazing.
Oh, good.
Can I take you home with me?
Yes.
Y'all gotta come try this, for real.
And then I want to thank our videographer, Omo. She's the latest addition to our team, and we just love having her here.